Okay, all the station is now standby. Hello, everyone. Now I am opening the healthcare session 2. My name is Young Sung Lee from Chungbuk National University, South Korea. From the early stage of a medical working group, this session has introduced the combination of information technology and medical learning technology. Recently, the brilliant advancement of information technology has led to the radical change in the environment of medical education. Today, the speakers of the session will report the application of information technology to their research and treatment education in diverse environments to share their experience and the know-hows with other scientists. Today, actually, 5 speakers from here, 2 speakers, and the other 3 from the remote area from Seoul National University and California, Stanford, and from the Vietnam. And I will introduce the first speaker from this venue. The first speaker would Young Ne Moon. He is an orthopedic surgeon, and he's actually professor, and also he has many specialties on editorial committee of a Korean Orthopedic Association and Korean Shoulder and Elbow Society, and also editorial committee of a Korean Orthopedic Sonographic Society. And he actually a lot of activities on the international some standardization on this field, international advice of a GOTS journal, and the review of a journal of American Orthopedic Society for the Sports Medicine, and also review of orthopedics 3D-based medical application working group, and the chair of IEEE Standard Associations. He is going to speak the new applications and the utilities of a medical 3D or 4D. Dr. Young Moon, please go ahead.
Thank you from Korea. I am Moon from Gwangju, Korea, and I'm orthopedic surgeon the Mr. Chairman told you. Yes, this first slide is showing the 3D printing material from the heart. Yeah, this is nowadays 3D printing material is the interest is the raise up. Sorry for yes the technical mistake. Yes, this is 3D printing material from the Belgium Lebeng, the company name of the materialized company. And my topic is new application and utility of 3D and 4D. What is medical 4D, not medial 4D? It contains touch sense or interaction, and additionally, time interval change, the information is contained. We call it medical 4D. I will tell you from the current situation and the future dream. Yes, I am catch this picture from the materialized company presentation. They are so much interested in statistical model from the China. Why they are interested in this kind of standard data of the Asian population? Because Asian population is so many compared with other continent. Additionally, this kind of the standard data from the anatomic the model would be next the new modeling for the next implant or next medical device development. Yes, that's it. Here is the example. This is data from the Korean shoulder, the humerus bone, and we can apply the United States version of the implant. Then we can the watch which is the well matched together with the imported one. So then they can make they can decide the most popular implant in the human body in the Asian population or others. Yes, this is the another 3D printing the material. Let me say differences. This point is very hard one, just uniform printing with hard material. Right side one is contain both um, the deep, oh sorry, dividing each ventricle and atrium, and this one is contain the artery, and this the pinkish one contain very soft one. So 3D printing is not the localized in focalized only for hard material. You should obtain the data from the texturing, the tactile sense also. We can obtain the data from this kind of sections, and then finally we can obtain this 3D material from the bone to soft tissues. Yes, I usually prefer utilize the uh, software name of the materialize. And I'm also working with this 3D standard, medical 3D standard group. She is the IEEE Standard Association chair lady. We doctors always want this amount of high qualified textile and high qualified material from the 3D printing or 3D the model. Additionally, we want real motion with the real bone data. So that's we call it the kinematics. And uh, we also want which is the change after the motion of the spine or other joint. And another important part of interesting point would be the osteoporosis. After people is aging process, the bone is more fragile than the younger stage. So our interesting part is 4D. It's a time interval change following their aging process. And yes, this is the the real texturing material for the surgical procedure. And when we invent a new device, we can apply the point of the something problematic area. Then we can showing which is the change after this device is applied. And yes, it's another explanation for the 3D standard material. If we obtain 3D standard model for each the country or each continent, we can make something the Asian specific model or European specific model or each races the model following their the characteristic size and the bone quality. Yes, I am working for the medical 3D standardization work with the United States, New Jersey. And the major part is 3D standardization and the 4D changes. Yes, recently we are very interested in the heart cardiac part as a vascular problem and the the pathway problem and any others. So we had a meeting at the SK Telecom at this year. Recently, we had a meeting at May this year. We have a six medical standardization meeting with the Italian group. So here is the three university in Rome and the other 3D. They are almost all. They are very interested in the cardiac project. Yes. So it's a very low version of my heart. So if we can open this heart, then we can see the lung, then we can see the heart. Additionally, as you know, the MRI contain only something rough data. So we made a new the standard model. Then it is following the MRI data. So there are lots of ways to obtain something more fine the 3D data from the lots of way. Yeah. Another important point is lung the change. I mean our lung is very different in between the inhale or exhale our the breath. Then it is so it's a very dynamic structure than others. So also the focal area of problem is also mobile. So we need to detect where is the point following their movement. Yes, this is the difference between inhale or exhale our breath. And another important point is we can simulate the our lung the airway by some simulators. Yes, this is um, the colonoscope, the digestive system, and the colon pathway, and our human skin texture is also available from skin to bone. Yes, usually when we obtain from the something 3D the rendering process, then just obtaining the material would be like this, just white and black, so or the grayish material. Then we can add this kind of something new texture. When I do the surgery, I take a picture from the patient, and even I am going. Yes, yes, but okay, okay. So additionally, we can see the inside of the joint, and it's inside of the joint and the outer side of the joint before we are doing surgery. So we can simulate the following the real data. This is another interesting data is when we develop the new implant, then we can simulate where is the most the compressive point during the motion. In this group, the Japan and the Italy is joining as an international group, and the other the Samsung and LG is also joined these 3D medical groups. Yes, this is a major. Yes, this is major scheme of the project. Obtain the 3D sectional data from the CT and MRI and make a 3D image and rendering. Then we can watch from the 3D viewer and diagnosis from the 3D modeled material. And we can do the 3D simulator with the interface or other device. And you can enjoy the virtual reality. And finally, in these days, another important point is big data. So we can estimate and evaluate patient data from the computer. Then doctor have enough time to evaluate. We do it only in the region of interest. We call it ROI. So I'd like to now I am working in the IEEE Standard Association, also working with government and companies, and the Tre University in Rome and Osaka University in Japan, and Technopark in my city. And additionally, I need work together with IT, BT, and IT NT convergence. So for this medical 3D work is very easy to do. However, if we want perfect 3D material, 3D something future medical 3D work, maybe I need you. So if we work together and if we collaborate together, our 3D material and 3D medical work would be perfect. Thank you.
Okay, thank you, Dr. Moon. It's very fantastic and advanced technology you showed us. So you include 3D printing technology and 3D design and also real data from the human patients. So I am wondering how about the feeling from the other clinicians in orthopedic surgeons, as you and your groups are very enthusiastic this activity, and you are very strong promoter. But I am wondering the other doctors group think this project would be promising, or what they thought about your project. Just a comment.
Yes, I yes, I don't wish they are going to be expertise for this 3D material. I I can introduce my 3D material to the medical doctor because I am medical doctor, so I know what medical doctor want. So my way would be most easiest one for the practice for the patient. That's my the own goal for with the IT and BT the specialist.
Okay, thank you. Is there any question from this venue and also remote area? If you have question, please raise your hand.